Welcome back. This is ANN News. Guinea launched its official vaccination campaign against COVID-19 with Chinese vaccines on Friday in the capital, Conakry. Frontline health and religious personnel and older citizens above 65 are getting vaccinated first. A batch of China-donated COVID-19 vaccines arrived in the country on Wednesday.
Guinea has joined several of its West African neighbors in rolling out its COVID-19 vaccine drive. Healthcare workers, frontline staff, and those over 65 will be given priority.
As you know, this vaccine is intended for frontline staff. These are health workers. Then there will be workers in strategic positions and the elderly in our country. Ultimately, we want to vaccinate 20% of our population. We will do it gradually. We will start here in Conakry first because the city is home to more than 90% of our frontline cases. Then it will be the turn for the neighboring prefectures. And finally, we will go through some prefectures where the cases are very active.
The country has also received 200,000 doses of the Sinopharm COVID-19 vaccine. The doses were donated by China.
Many countries are asking for the COVID-19 vaccine, and it is very difficult for developing countries to access it. To help these countries get these vaccines, China promised to make them a global public good so that they would be accessible and affordable in developing countries. To this end, China has been working hard to make Guinea one of the first countries to benefit from Chinese vaccine donations so that the country can vaccinate its population as soon as possible.
Guinea's vaccination campaign is set to run for several months. The country hopes to vaccinate nearly 70% of its population.
Economists say an increase in South Africa's national minimum wage, which took effect 8 days ago, will likely lead to further job losses in the agricultural sector, where employers say they may not be able to sustain the increase. Correspondent Angela Coppola has the story.
The agricultural sector continues to operate during the COVID-19 lockdown. It contributes about 3% to GDP. Around 900,000 people are employed in the sector, and it provides much needed food security for the country. The minimum wage increase may affect this.
Farmers will obviously look at ways and means, one, to cut down on labor cost. In other words, they will look at mechanization as an option, or they will reduce the number of workers. And the only way that you can actually reduce numbers if you close down certain parts of your agricultural business.
The agricultural sector covers a wide spectrum of subsectors, some of which don't need a lot of workers. But there are sectors like deciduous fruits, table grapes and wool, which do require workers.
And that's where a national minimum wage can have a serious impact. One, on obviously on the profitability of a commercial farmer, and secondly, also on the possibility of creating more jobs. And at the end of the day, it's workers that suffer as a result of a national minimum wage, which is then unaffordable.
It's only the farm workers who are directly affected because the 16% increase in the minimum wage only applies to them. Workers in the rest of the agricultural value chain aren't affected. AgriSA wants the government to take a different approach.
Government need to relax the onerous compliance measures that are built into, one, labor laws, secondly, into the national minimum wage, and also other laws that might have an impact on the profitability of the agriculture sector.
South Africa's unemployment rate is 32.5%, and AgriSA says that tackling that should be the focus.
Our first priority now should be to get everyone into a job as soon as possible. Unemployment is the biggest driver of poverty, and we've seen rising poverty in rural areas all over South Africa.
It's all about the minimum wage. It's also about profitability of those commercial farms. So it's important that there's a compromise found.
Uganda has received the second batch of 100,000 doses of the AstraZeneca COVID-19 vaccine from India on Sunday. The first batch of 864,000 AstraZeneca vaccines had arrived on Friday through the COVAX facility. The Ministry of Health says although the country's vaccination program was officially launched today, Monday, it will be rolled out nationwide on Wednesday. The ministry says the doses will be used to vaccinate persons that provide essential services and are at high risk of exposure, including elderly persons, healthcare workers, teachers, and soldiers. The Health Ministry says Uganda needs at least 45 million doses of COVID-19 vaccines to inoculate the country's 45 million population and extra doses for the refugee community. China has donated about 300,000 doses of Sinopharm COVID-19 vaccines to the country. Uganda is working on technical processes for receiving them. The ministry reported as of Friday, Uganda had registered nearly 41,000 cumulative confirmed cases of COVID-19, 15,000 recoveries and 334 deaths since the first case was reported in late March last year.